She was told to wait. Then she was told it was post-treatment Lyme disease syndrome, but her infection never left. I'd like to talk today as part of a Common Sense Lyme series about patients I've seen and questions that have come up in my practice. So let's begin. She was in her 30s. She had known there was a tick bite. She was treated with 3 weeks of doxycycline. Then she was advised to wait and see. The symptoms worsened. 6 months later, she had fatigue, brain fog, and joint pain. What watchful waiting missed is that there were no follow-up labs, no reevaluation, no tests for co-infections. They didn't pursue a persistent tick-borne infection. She went months untreated. She was diagnosed with post-treatment Lyme disease syndrome. She was told the infection was gone. They attributed to post-treatment effects, perhaps immune-related issues. No further treatment was offered. She had ongoing fatigue, air hunger, and night sweats in addition to the remaining symptoms. She had evidence of babesia by exam. Her tests confirmed it by antibodies. She was treated for Lyme and babesia, and she started getting better with the combination of treatment. She had a gradual improvement in energy, cognitive function. She was able to work again, enjoy her life. So even though the recovery was delayed, she got better. Now, watchful waning is a problem because it can delay treatment of a persistent infection. I am opposed to using post-treatment Lyme disease syndrome as a diagnosis because it's so easy to just blame it on immune issues, and a persistent tick-borne infection is not usually discussed. Once someone is sick, remains sick, I prefer to reevaluate, follow them, look for co-infections like babesia, Bartonella, and if the tests are inconclusive, is to use clinical judgment. I use other doctors to roll out of the illnesses during the follow-up. The bottom line is she wasn't treated. She was considered post-treatment. Early recognition and appropriate treatment might have allowed her to prevent months of being sick. Fortunately, she got better, but it gets more complicated to treat if you wait months, from my experience. Thank you for joining me for this Common Sense Lyme series. Have a good day.